the thing about this too that's important to look at is that heart rate will change this. So the mean gradient of 10 is only valid with a heart rate less than 90. That's the really, really important thing to look at. And we've had to educate a lot of sonographers and cardiologists with this in our system, because we'll have a mitral stenosis patient, potential mitral stenosis, they'll have a mean gradient of 12, but their heart rate is 100. And there's different categories for stress tests, which is when we bring that heart rate up to look at the mean gradient. So when you start doing a stress test over 100, then you start looking at 12, 13, 14, 15 as the standard. But for just a basic echo, a baseline echo, heart rate has to be less than 90 in order for the mean gradient to be reliable. And why is that? Well, what happens with the heart rate? What happens to our diastolic filling? Diastolic filling compresses. It shortens. We don't have as much time to fill. So what happens to our E and our A wave? If our diastolic time frame shortens, this is going to compress. When that compresses, what happens to this value here? This value here, if it compresses, A wave is going to go over to here. So now we're not going to drop down to baseline. That's how we get that reduction in that mean pressure gradient. So the pressure is going to be staying up the entire time. So pay attention to your heart rate when you're doing this. Make sure that it's less than 90 so that you don't miscategorize it just based off of the mean gradient.